Okay, and welcome back. So on this video, what I'm hoping to do is to continue our revision of the important muscles, skeletal muscles of the body, and we're going to pick up from where we finished in the last video. So we're going to start with the review of the muscles of the upper limb and then move on to the lower limb. So it's noteworthy to pay attention here that the fascia, the connective tissue, divides typically the upper limb, especially the arm region, into two compartments. And typically we see that the anterior muscles are responsible for flexing, whereas the posterior muscles are responsible for extending. So we can already figure out a little bit about these muscles based on which side of this fascia layer or fascia compartments they sit on. And let's start with the most obvious one. So I want to start with the triceps brachii muscle on the posterior side. So this is the back side that we're seeing here. And we're really seeing that it has two heads. So we have a lateral and long head. And thinking about the bony structures that we're familiar with when we're trying to figure out the triceps brachii muscle, where it attaches. So the long head attaches below the glenoid cavity of the scapula, whereas the lateral head attaches at the posterior shaft of the humerus. And from those, they run to the olecranon of the ulna. And the function of the triceps brachii muscle is really to extend the forearm. And notice again that it's the posterior side that's responsible for extending. Let's highlight here our biceps brachii muscle. So we are going to see two heads for it. And these bony structures where they connect, the long head connects to the glenoid cavity region, whereas the short head connects to the coracoid process of the scapula. And from those, this muscle runs to the radial bone's proximal end. And the function of the biceps brachii is really to flex and supinate forearm. So again, notice we are looking at the anterior side, so these are going to be flexors. And again, we're seeing both of these nicely summarized here on this slide. Let's keep moving onwards our journey of the upper limb, and let's look at brachioradialis muscle. This is superficial muscle at the lateral forearm. And thinking of the bony structures that we're familiar with, brachioradialis muscle connects at the distal end of the humerus at the lateral supracondylar ridge and runs from there to the radius, so radial styloid process. And again, thinking of the function of the brachioradialis muscle, that is going to be the flexion of the forearm. It is on the anterior side, so contributing to the flexion. Here we're seeing a rather interesting muscle, supinator muscle. This is a deep muscle at the posterior elbow, and what we end up seeing is that they really connect at the lateral epicondyle of the humerus, running to the proximal end of the ulna. And the function is, not surprisingly, based on the name, supination. So you remember the supination of the upper limbs really gave us this position where the palms were facing forward. So I gave you the mnemonic of to carry a bowl of soup when we're supinating. But remember that we are seeing many muscles working together. So supinator is a synergist with the biceps brachii muscle in forearm supination. So there's multiple muscles acting together. So now a few words about the muscles that act on the hand, especially they are often located more proximally on the upper limb. So they typically end up acting through tendons. These are the connective tissue strings that connect the muscle to the bone. This is how our hand doesn't get really crowded with the muscles, whereas the muscles are actually located a little bit more proximally, and just it is our tendons that then connect to these bones. Also, to study the muscles, I want to remember to consider their depth. And what we end up seeing with these muscles of the hand, most of these arise from the common flexor tendon attached to the medial epicondyle of the humerus. So here we're seeing flexor pollicis longus muscle. This is the anterior forearm and responsible for acting on the thumb. And thinking of the bony structures that we're familiar with, flexor pollicis longus muscle connects at the anterior radius's proximal end and runs from there to the distal phalange of the thumb. And the function is really to flex the thumb. Notice that the thumb is really important for gripping and fine actions. So we have a special muscle for that process, and that's our flexor pollicis longus muscle. We also have flexor digitorum profundus muscles. These are responsible for all other fingers. So connecting again from ulnaris medial end and running to the distal phalanges of the fingers 2 to 5. So all other fingers but the thumb. And their function, flexor digitorum profundus, is responsible for flexing all other fingers but the thumb. Here we're seeing also flexor digitorum superficialis muscle, and we're seeing that we have two heads that kind of overlays the previous one. So again, thinking of the bony structures, attachment points attaching from humerus's medial epicondyle and running to the ulna's proximal end and following the shaft of the radius all the way to the second, third, fourth, and fifth fingers phalanges. So the function of the flexor digitorum superficialis muscles is to flex the middle phalanges of fingers 2 to 5. So all other fingers but the thumb. And again, I think that this is a rather nice summary of all these muscles that we just discussed about. So hopefully that's useful for you to have to refer back to. Now let's pick up and look at the posterior muscles of the hand and upper limb. So these consist of superficial and deep muscles, and all of these are innervated by radial nerve or its branches. And most of these arise from the common flexor tendon attached to the lateral epicondyle of the humerus. And because these are on the posterior side, these are extensors that we're going to be looking at. So we're going to start with the extensor digitorum muscle, and this extends the fingers. So it connects to the lateral epicondyle of the humerus and runs from there to the second, third, fourth, and fifth fingers distant phalanges. And the function really is to extend the fingers 2 to 5. So that's our extensor digitorum muscle. Let's look at extensor carpi ulnaris muscle. The origin of this muscle is from the same bundle, and again connecting from the lateral epicondyle of the humerus to the little finger of the fifth finger's metacarpal. And the function of extensor carpi ulnaris is to extend the fifth finger. I also wanted to mention extensor digiti minimi muscle, and this connects again at the same bundle and running to the little finger, so our fifth digit. The function, to extend the fifth finger. And here we see a nice summary of these muscles that we just had a look of in this very last section. And I think that we're ready to move on from the upper limb to the lower limb. So let's have a look of those muscles, key muscles from the lower limb a little bit. Before we do so, I want to kind of orientate ourselves a little bit. And what we're seeing is that on the lower limbs, the muscles of the lower limbs are grouped according whether they're anterior, medial, or posterior. And the most anterior muscles are responsible for flexing femur at the level of hip and extending leg at the level of the knee. So these are responsible for the foreswing of walking. So the anterior muscles contribute to this forespring, swing of the walking. Most posterior muscles instead extend at the level of the thigh and flex at the level of the leg. So the posterior muscles therefore are responsible for the backswing of the walking. And you can see that stickman diagram that I sketched there, that's hopefully helping with associating this information together. We do see that the medial muscles, they all adduct the thigh, and all three groups that we just discussed are enclosed by fascia lata. And we see a large range of movements here. We see, for example, flexion, extension, abduction, adduction, circumduction, and rotation taking place here. So let's have a look at these individual muscles a little bit. And let's start with our adductor muscles. And we're going to have three muscles here. We're going to have our adductor magnus muscle, adductor longus muscle, and our adductor brevis muscle. These are a large group or bundle of muscles at the medial aspect of the thigh. And again, thinking of the bony attachment points, these connect at the pubis, so the inferior bump right next to the pubic symphysis, and run from there to the shaft, so linea aspera of the humerus. And if we think of the functions, the clue is really in there in the name. So adductor magnus, adductor longus, and adductor brevis, they adduct. That's their main function. But we do see that they also contribute to the flexing and medially rotating the thigh. Now let's look at the quads. So the name tells us that we're going to see four heads. So these quadriceps femoris muscles are made of four muscles, three of them which we will look at. And the first muscle that we're looking at is our vastus lateralis muscle. So this is forms the lateral aspect of the thigh, a very common site for intramuscular injection, especially in infants, because infants don't have, or they have a rather poorly developed buttocks and arm muscles. So we often gravitate towards this site. And then we're also seeing on this picture vastus medialis muscle. This forms the inferior medial aspect of the thigh. And let's look at some of the bony connections where these muscles attach. So we're seeing the femur's proximal end. And for the vastus lateralis muscle, we see the greater trochanter, whereas for the vastus medialis muscle, we see the intertrochanteric area. And from there, they run over the patella to the tibial tuberosity. And if we think of the function of the vastus lateralis muscle and vastus medialis muscle, it really is for the vastus lateralis muscle to extend and stabilize leg, whereas the vastus medialis muscle really extends the leg. I also wanted to mention rectus femoris muscle here on this picture. So this is the superficial muscle of the anterior thigh. And again, thinking of the connection points to the skeleton at the superior margin of the acetabulum, so the hip socket, over the patella, all the way to the tibial tuberosity. And the function of rectus femoris muscle is to extend the leg and flex the thigh at the hip. And again, we're seeing a very nice summary of all of these muscles that we just discussed. So hopefully that's helpful for you to kind of put them together. Let's have a look at the muscles of the hip and thigh on the posterior side. So let's look at the muscles of the buttocks. And there's really three of these for us to have a look of: gluteus minimus, gluteus medius, and gluteus maximus muscle. We will look at two of them. So let's start with our gluteus medius muscle. This is a thick muscle site of intramuscular injections. This is very common site for these injections because there's a low risk of nerve damage on this area. And looking at the gluteus medius muscle and the bony structures where they connect, it's really the lateral surface of the ilium running from there to the greater trochanter of the femur. And thinking of the function of the gluteus medius muscle, it is to abduct mainly, but we see also some amount of medial rotation and supporting the hip in general. And then the second muscle that I wanted to discuss here on this region is obviously our gluteus maximus muscle. This is the largest and the most superficial, really forming the bulk of the buttocks. And again, a good intramuscular injection site. Thinking of the bony structures connecting to the dorsal, so back or tail end of the ilium, sacrum, and coccyx, and running to the tuberosity of the femur. And thinking of the function of the gluteus maximus muscle, it is a very important extensor of the thigh. And some of the other roles that I can think of for this is the lateral rotation and abduction of the thigh. So that concludes our gluteus maximus muscle. And we see again the summary of these two muscles. We'll actually see the third muscle as well on this diagram. So hopefully that helps to put it all back together. Let's have a look of the hamstrings. So these are fleshy muscles of the posterior thigh, and they cross both the hip and knee joints, and they are the prime movers of the thigh extension and the knee flexion. They are innervated by sciatic nerve, and we might see a condition that's very common sports injury known as pulled hamstring. So basically hamstring strain. So this is appearing as a sudden sharp pain at the back of the thigh, and the treatment really is following our rule of RICE. So rest, ice, and compression. Obviously, we could do also elevation, we could do rehab, we could do exercise in right amounts that fits the recovery. So let's look at the muscles that make up our hamstrings. So the first muscle I'm highlighting here is our biceps femoris muscle. This is the most lateral one of these, and notice that it has two heads. Biceps femoris muscle connects in terms of the bony structures. The long head connects to the ischial tuberosity, and the short head connects to the distal or the shaft's half of the femur, and laterally going past knee and joining to the head of the fibula, and I guess also to the lateral head of the tibia. The function of the biceps femoris muscle is really to extend the thigh and flex the leg. And here we're seeing semimembranosus muscle. This is a deeper muscle from what we've just had a look of. And we're also seeing semitendinosus muscle. This is the more superficial one, located medially to the biceps femoris muscle. And again, thinking of where they attach, connecting to the ischial tuberosity and running from there to the medial part of the proximal tibia. The function is really for semitendinosus muscle to extend the thigh and flex the leg. And again, a rather nice summary of all these muscles that we just visited in case you want to put it all back together. Now let's keep going onwards and have a look of the muscle of the anterior compartment. This is going to be our tibialis anterior muscle. This is a superficial muscle of the anterior leg and follows the margin of the tibia on the lateral side. Looking at the connections to the bony structures, connecting to the lateral condyle, so the top bump of the tibia, and going all the way to the start of the big toe. And the function of the tibialis anterior muscle is really the dorsiflexion. And here we're seeing a summary, and of course there are a bunch of other muscles. So I've chose some of those for us to focus, but you see a little bit more extensive list on this figure. Let's move on to the muscles of the lateral compartment of the leg, and I wanted to highlight first our soleus muscle. This is a deeper of the muscles located at the posterior calf, and thinking of the bony connections running from superior tibia to the fibula, extensively covering really the top of the tibia and fibula and going to the heel, so calcaneus. The function of the soleus muscle is really the plantar flexion of the foot. And then we have our gastrocnemius muscle, which is the superficial muscle that has two prominent bellies, connecting again in terms of bony structures to the medial condyle of the femur and lateral condyle of the femur, and running from there to the heel, so calcaneus. The function of the gastrocnemius is the plantar flexion of the foot. And again, here I have a rather nice summary of these. So to finish off our discussion of the muscles, I think it would be nice for us to look at a little bit of development and life cycle changes of the muscles. What's there to note about that? So let's have a look at what happens over lifetime. In order for remaining healthy, muscles must be exercised, and without the exercise, these muscles start to atrophy. And with extremely vigorous exercise, these muscles can actually hypertrophy. And as we age, the muscle mass decreases and the muscles become more sinewy. Exercise does help to retain muscle mass and also the muscle strength. It brings us to the end of reviewing all of these muscles. I know it's been quite a bit to cover, but as always, I'm very impressed by your work, and I encourage you to use your notes. I encourage you to follow along on coloring or marking them on your list as you go through these one by one. This concludes our review of the skeletal muscles. It certainly has been a joy. I'll see you at the next class.